Hello and welcome. In today's video, we're going to explore a deeply important and sensitive topic, the subtle signs that an elderly loved one may be approaching the final stage of life, sometimes as much as a year before passing. It's a subject that many of us would prefer to avoid, but recognizing these signals in advance can make a world of difference in providing care, emotional support, and peace of mind. Please stay with me until the very end, as there will be crucial insights throughout. You'll learn about 5 key indicators, how to respond to them, and how to ensure that your family member feels loved and cared for in their final months. Let's begin. I want to start by addressing the most common misconception, that old age or serious decline arrives abruptly. Many of us imagine a sudden event, one day everything is fine, and the next the situation drastically worsens. But in reality, the body often shows us signs of its waning strength and shifting priorities long before what we think of as the final days. Sometimes these changes start a year in advance, slowly but progressively becoming more apparent. When we're unaware of these indicators, we risk missing precious opportunities to handle practical matters, to share meaningful conversations, to reconcile unresolved feelings, and to simply be fully present with our loved one. By understanding the specific signals the body sends in its final chapter, you can anticipate needs, handle emotional challenges with greater calm, and ensure dignity and comfort for the person nearing life's end. Throughout this video, I'll present 5 main signs. Each sign in itself might not be conclusive evidence of imminent decline, but when observed together or in close succession, they often paint a clear picture that time is more limited than we might hope. With each sign, I'll share practical tips for supporting and caring for your loved one. Let's move into the first sign now. Sign 1. Gradual but noticeable weight loss. One of the earliest and most telling indicators that an older adult may be entering the last year of life is a persistent decline in body weight, especially if there hasn't been a deliberate effort to eat less or switch to a restrictive diet. Maybe their clothes start looking baggy, the belt notch moves in further, or that once regular appetite is now very much diminished. Why does this happen? The aging body begins to have difficulty absorbing nutrients, the metabolism slows, and the drive to eat simply diminishes. This isn't just getting older. In many cases, it's a physical manifestation of the body's organs downshifting, gradually losing efficiency and preparing to conserve energy rather than build or sustain muscle and tissue. The immune system might already be taxed, and digestion can become less effective, leading to less protein and fewer essential minerals being utilized for muscle maintenance. What should you do? First, note if your loved one expresses decreased interest in meals or begins to skip them entirely. Encourage nutrient-dense but easily digestible foods, things like soups rich in protein, smoothies or shakes fortified with vitamins, or small soft snacks that are easy to chew. Instead of pushing heavy, large meals, offering smaller, more frequent portions may be kinder to a weakening digestive system. It can also be helpful to create a calm, pleasant environment around mealtimes. Reduce distractions, keep the conversation light but warm, and gently encourage them to eat at their own pace. If the doctor approves, consider a nutritional supplement. However, it's important to remember that if the body is in a deeper state of decline, no amount of eat more can fully reverse that trend. The best approach is compassion, gentle support, and an understanding that this weight loss may be part of a natural transition. Before we head to the second sign, I'd like to invite you to reflect on any older relatives or friends in your life. Have you seen changes that might align with this description? If so, keep watching, because the next signs might resonate with you even more. Sign 2, profound fatigue and decreased energy. Few things are more telling than a dramatic shift in a person's energy levels. Perhaps the elder in your family was once fairly active, able to walk around the neighborhood or do chores, but now they spend more and more time in bed, may skip social visits, and appear constantly exhausted even if they haven't done much. This isn't just normal, I'm getting older and I tire more easily. It's a deep, unrelenting fatigue. What causes this fatigue? As we approach the latter stages of life, vital organs, such as the heart, kidneys, and lungs, may start to function less effectively. This leads to reduced oxygenation of the blood and inadequate delivery of nutrients to the muscles. The overall metabolic rate slows dramatically. For someone near the end of life, The body is trying to conserve precious energy to maintain only the most critical functions. Emotional impact. On top of physical tiredness, there's often an emotional drain. Many seniors feel frustrated or ashamed that they can no longer do simple tasks. Others might feel guilt for being a burden, which can further sap emotional stamina. Alternatively, some may seem indifferent or apathetic because the energy required to engage is simply beyond them. How can you help? 1. Allow more rest times. Don't pressure or tease them for sleeping the day away. Respect that the body is signaling the need for rest. 2. Assist in daily routines. Help with chores or break them into small segments. Encouraging gentle stretching or a short walk can be good, if they're up to it, but don't push. 3. Keep communication simple and warm. Prolonged conversations can be tiring. Give them room to breathe, and if you see they're worn out, allow them to rest without guilt. 4. Watch for frustration or sadness. Acknowledge their feelings. Let them know you understand it's hard and that they don't have to fight alone. Sometimes the greatest gift we can give someone at this stage is permission to slow down without shame. By recognizing profound fatigue for what it is, we can adapt our expectations and ensure our loved one feels supported instead of judged or pressured. There's a third sign that often goes hand in hand with these first two, so keep watching if you suspect your loved one might be on this path. Sign 3, cognitive changes and withdrawal. Another signal that an elderly person may be entering their final year of life is the onset of more frequent confusion, forgetfulness, or even shifts in personality. You might notice they repeat the same story multiple times, forget who they're speaking with momentarily, or get lost in a place they've known for decades. Alternatively, they could become unusually withdrawn, speaking less and avoiding eye contact. Why does this occur? Our brains depend on a healthy blood supply, oxygen, and proper nutrition to function. When circulation weakens and oxygen levels drop, cognitive function naturally declines. In some cases, previously well-managed issues like mild dementia can suddenly worsen, or an entirely new pattern of confusion can emerge without an existing dementia diagnosis. Mood and behavior shifts. It's also not uncommon for an elderly individual to become irritable, anxious, or even display personality traits that feel totally out of character. A once sociable person may become quiet, or a gentle soul might develop a short temper. This can happen because the emotional centers in the brain are also affected by reduced blood flow, chemical imbalances, and overall decline. Practical tips for family and friends. Maintain a reassuring presence. Even if conversations become repetitive, respond with patience. They may need gentle reminders about where they are or who you are, and that's okay. Simplify the environment. Too much noise or activity can increase confusion. Aim for calmer surroundings, reduce unnecessary clutter, and keep to a predictable schedule. Offer loving touch. A simple hand on the shoulder or holding their hand can provide comfort. Even if words become muddled, a caring physical presence can be grounding. Seek medical insight. Sometimes, sudden bouts of confusion can be triggered by infections or medication side effects. If you see a rapid change, consult a healthcare professional. It can be heartbreaking to watch someone you love slowly slip away from their former clarity and personality. It's essential to remember that this isn't something they're doing consciously. Offering patience and compassion can help them feel safe and loved, even as the mind begins to wander or fade. If these first 3 signs, weight loss, fatigue, and cognitive changes, sound familiar, you'll want to understand the next 2 just as deeply. They reveal more about the body's diminished ability to combat external stressors and maintain normal physiological functions. Sign 4, frequent infections and slow healing. If you notice your loved one falling ill more often, whether it's catching colds, dealing with bouts of pneumonia, or struggling with urinary tract infections, and they take far longer to bounce back than before, this could be a sign of the immune system weakening considerably. Likewise, minor wounds may remain unhealed for weeks, indicating that the body's self-repair processes are no longer operating efficiently. Why does this happen? 1. Weakened immune response. The body naturally reduces the vigor of its defensive mechanisms in the advanced stages of life. With less energy going into immune function, common germs cause more severe or persistent illnesses. 2. Poor circulation. Reduced blood flow means cuts and bruises aren't repaired as promptly. Fewer white blood cells reach the affected areas, leading to prolonged healing times. 3. Potential complications. Infections that might have been minor in younger or healthier individuals can turn into serious conditions, requiring hospital care or potent medications. Supporting a loved one during frequent illnesses. Encourage gentle hygiene routines. Help them wash their hands regularly, keep living areas clean, and maintain oral care as best as possible to minimize infection risk. Chumatun. Consult with healthcare providers. If colds or UTIs become chronic, a doctor may propose preventive strategies or specialized care. Kurtso, watch for silent symptoms. Among seniors, infections sometimes don't present with the typical fever or obvious pain. Instead, they may show subtle changes in behavior, sleep, or alertness. Take note of sudden declines or confusion, and don't assume it's just aging. Focus on comfort. While medical intervention may be necessary, always weigh the benefit versus the stress of repeated hospital visits or aggressive treatments. The goal might shift from treating at all costs to ensuring the best possible comfort. Witnessing someone you love battle recurrent infections can be distressing. Family members often feel helpless, questioning if there's more they could do. Sometimes acknowledging the body's natural decline is hard, but when we accept it, we can shift our energy toward making them as peaceful and pain-free as possible, rather than chasing endless curative measures that might prolong discomfort. We're almost at our final sign, and this last one is especially telling in the advanced stages of life's journey, when the circulatory and respiratory systems begin to show their scaling back. This is where changes can become visually and audibly apparent, offering a clear signal that the final months or weeks could be approaching. Sign 5. Changes in breathing and blood circulation. Breathing can reveal a lot about a person's overall health. In someone nearing the end of life, you might observe shallow, irregular breathing, or a pattern of short, rapid breaths followed by longer pauses. Some people develop what's commonly known as Cheney-Stokes respiration, breaths that alternate between deep and slow with gaps in between. Simultaneously, you might notice the person's hands, feet, or even nose and ears growing cold to the touch or turning a pale or bluish color. This is a sign that circulation is being prioritized for vital organs. The body's natural intelligence senses that it no longer needs to keep extremities as warm, shifting resources inward instead. Other respiratory details. Nidrumimon, fluid in the lungs. Sometimes fluid buildup causes congestion or a gurgling sound while breathing. This can feel alarming, but it's not always painful. Propping them up with pillows can alleviate discomfort. Shortness of breath during small tasks. Even speaking a few sentences might leave them winded, requiring breaks to breathe and gather energy. Preference for certain sleeping positions. Many people opt to sleep or rest in a reclined, upright posture to help air circulation. Caring strategies. Provide a comforting environment. Keep the room at a comfortable temperature, and if possible, ensure a source of fresh, clean air. Some benefit from a humidifier. Support adjustments. Assist them in shifting positions when they seem uncomfortable. Offer pillows for support behind the back, under the arms, or beneath the knees. Consider medical guidance. In some cases, supplemental oxygen or mild medication can help ease breathing challenges. Discuss the pros and cons with a healthcare professional. While future, remain calm and reassuring. Labored breathing can look and sound distressing, but your serene presence and supportive words can help them stay relaxed. The body's reduced focus on circulation to the limbs and fluctuations in breathing patterns often indicate a deeper biological reorientation, preserving energy for essential functions and gradually disconnecting from non-critical processes. When you notice these changes, it can be emotionally challenging, but understanding that this is part of a natural process can bring a sense of peace and acceptance. Bringing it all together, we've covered 5 main signs. 1. Steady weight loss. 2. Persistent exhaustion. 3. Cognitive shifts and social withdrawal. 4. Frequent illnesses and slow healing. 5. Altered breathing and circulation patterns. While each of these can appear in isolation for various reasons, if you see multiple signs emerging and intensifying in someone who is already advanced in age, the likelihood that they are in their final phase of life rises. This knowledge, while heartbreaking, can also be a gift. It allows you time to prepare emotionally, time to have meaningful conversations, time to ensure all the practical details, like important documents, final wishes, or unresolved family tensions, are addressed. It can help you shift your perspective from "we must fix everything" to "we must ensure you're as comfortable, peaceful, and loved as possible." Modern medicine can do a lot, but it cannot always reverse an underlying natural process. Once you realize that such a process might be unfolding, you can channel your energy into being fully present, providing simple joys, maintaining their dignity, and offering emotional warmth. Tips for emotional preparedness and support. Chapter 1. Open communication. Speak honestly but gently with your loved one about their experiences. They may appreciate someone acknowledging that they're feeling weaker and want to talk about it. If they show a desire to have such conversations, don't shy away. Silence often increases anxiety, while open, compassionate dialogue can alleviate it. 2. Create comforting routines. Simple daily rituals can help someone feel more secure, whether it's having tea at the same time each afternoon, listening to favorite songs, or reading to them quietly. Consistency provides reassurance. 3. Offer heartfelt reassurance. Let them know you're there for them. Affirm you love them, that they haven't become a burden. A calm voice saying, "I'm here, everything is okay," can reduce worry more than you might imagine. 4. Seek outside help. When caring for someone at the end of life, you don't have to do it all on your own. Palliative care teams, hospice services, and visiting nurses can offer medical management and emotional support, both to the patient and the family. 5. Self-care for caregivers. It can be emotionally and physically draining to watch someone decline. Make sure you're tending to your own mental and physical well-being. Whether it's talking to a therapist, joining a support group, or taking short breaks to clear your mind, your health matters too. Why this matters? For many in our older generation, and for the families who care for them, the fear of death is often entangled with uncertainty and isolation. When no one discusses the signs or the normalcy of the process, it can amplify that fear. Recognizing these 5 indicators is less about gloom and doom and more about embracing reality so that the individual does not pass away in a whirlwind of chaos, denial, or panic, but rather in an environment of compassion, calm, and respect. Every person's journey is unique. Some may not exhibit all 5 signs. Some might show others that are equally indicative, like severe swelling in the limbs or sudden changes in skin color. But in general, these 5 encompass a broad spectrum of physiological and behavioral clues that the body is transitioning. From experience, I've seen how acknowledging these signs early helps families focus on what truly matters: being there for the person, addressing old misunderstandings, sharing treasured memories, or simply holding a hand in silence. There is a special kind of peace that can arise in facing this stage of life with openness and presence, rather than with avoidance or fear. A last word of encouragement. I know this isn't an easy topic. If you've stayed with me through this entire discussion, my hope is that you feel more equipped to handle whatever might come. Perhaps you already see some of these signs in a parent, grandparent, or older friend. Remember, knowledge can be a powerful antidote to despair. It allows us to plan, to clarify, and to find emotional grounding. Let me leave you with this. Often, when we're losing someone we love, it's the simple, consistent acts of care that matter most. A comforting presence at bedtime, a patient ear when they're frustrated, a gentle reminder that they remain cherished. This is what resonates on both sides. The dying individual feels supported, and you, as the caregiver or family member, find solace in having done all you can to ease their journey. If you found value in this video, please consider sharing it with others who might need this insight. Your like and subscription not only encourage me to create further helpful content, but also help these messages reach those who might be silently struggling with the same challenges. What you can do next. Reflect on the 5 signs. Ask yourself if your elderly loved one is showing any of these symptoms. Document them in a journal if necessary, so you can track changes over time and provide accurate information to medical professionals. So start gently opening conversations. If you suspect the person might be nearing their final year, consider discussing their wishes. Do they have certain preferences for medical interventions? Is there something special they'd like to do or see? Shioki professional guidance. Early, don't wait until a crisis hits. Reach out to healthcare practitioners, hospice organizations, or geriatric specialists for guidance on comfort measures, symptom management, and emotional support resources. Build a circle of support. Involve other family members or close friends. Coordinate short visits or phone calls to keep the person socially connected in a gentle, manageable way. If they tire easily, spread the visits out so as not to overwhelm them. Acknowledge your own feelings. Anticipatory grief is real. You may begin mourning the loss before it has fully happened. Talking to a counselor, confiding in close friends, or joining an online support community can provide comfort during this emotional time. This is a challenging road, but it can be navigated with grace, tenderness, and understanding. By recognizing the subtle and not so subtle hints the body gives us, we can adapt to the reality at hand. Instead of racing for a cure that may no longer be possible, we can shift gears toward ensuring each day is as fulfilling and comfortable as it can be. Thank you for taking the time to join me in this conversation. If any part of this video resonated with you, or if you have experiences or thoughts you'd like to share, please leave a comment below. I often find that hearing from others provides both wisdom and comfort, reminding us all that we're not alone in this universal journey. Remember, compassion, presence, and honest understanding go a long way. In recognizing these signs and responding with patience and love, you're giving one of the greatest gifts possible to someone nearing the final stage of life, the reassurance that they are seen, valued, and never alone. Stay well, and I look forward to seeing you in our next discussion. Until then, take care of yourself and those you love.